Everyone, and good afternoon, Virginia. I want to start by explaining why I am remote today, coming to you from the Kentucky Governor's Mansion. The reason is that this morning my son tested positive for COVID-19 through a rapid test, which was later confirmed by a PCR test. He is generally asymptomatic, we believe, because he is both fully vaccinated and recently boosted. In fact, he's shooting basketball right now by himself at this very moment. He is a tank. He is going to be just fine, but he wants to make sure he doesn't infect any of his friends or, for that matter, anyone else. The rest of our family is negative, having been tested twice today. I've been tested twice today through a rapid and a PCR test, but we are trying to be extra careful given Will's testing positive this morning. I'm going to test each morning, and provided that it is negative, I'm going to put on a very good fitting mask and go about work as normal per the current CDC guidelines. With that, I'm going to give first updates on our tornado relief, and then we'll kick it over to Dr. Stack, who is in our traditional All right. Can you hear me, Virginia? Okay. So I'll give an update on the tornado relief, and then we will kick it over to Dr. Stack to provide our normal COVID update. First, let's talk about tornado relief by the numbers. To date, FEMA and the U.S. Small Business Administration have approved nearly $36 million in total federal assistance for survivors of the December 10th tornadoes. More than $10.7 million in FEMA assistance has been approved for individuals and households, including more than $7.6 million for housing assistance and more than $3 million for other disaster-related needs. Nearly $25 million in SBA disaster loans have been approved for homeowners, renters, and businesses. More than 11,600 applicants were referred to FEMA's individuals and household programs. More than 8,800 home inspections have been completed. Disaster survivor assistance teams connected with more than 8,300 survivors to date. So let's remember how to apply for assistance. The deadline to apply with FEMA is Friday, February 11th. So much of the other aid, like the Team Western Kentucky Tornado Relief Fund, is connected to filing an application with FEMA. The deadline is February 11th. Once again, it's important this gets out there to absolutely everyone impacted. The deadline to file for FEMA assistance, if you have been damaged in any way by this tornado, is February 11th. So to apply, visit disasterassistance.gov, use the FEMA mobile app, or call the FEMA helpline at 800-621-3362. To find a disaster recovery center, visit FEMA.gov/DRC or call the same FEMA helpline. A breakdown of agencies, programs, phone numbers, and website links to assist survivors of the Kentucky tornadoes in their recovery is available online on the FEMA website. The state also offers resources at governor.ky.gov/tornado resources. And so much of the regular day-to-day help and the information can be found on that website. I'll talk about that here in a minute. But let's next move to debris removal. And that starts by reminding everyone how devastating these tornadoes are. Normally, a tornado, even one that brings in FEMA, will touch down, maybe destroy several neighborhoods. But rarely, if ever, does it destroy entire cities, entire downtowns. Here, 70+% of all homes in Dawson Springs. This is devastation and an amount of debris like never before. And I'm going to give you some numbers on it in a minute. But it is going to take months. They believe that Mayfield, it's going to take at least until the end of April for debris removal. So remember, we've got to dig in, knowing that this is going to take a lot of time because of how destructive these storms are. And let's not get frustrated. Let's not attack those that are out there cleaning it up. It's the level of damage that creates the length of debris removal. The U.S. Army Corps of Engineers estimates that more than 4.6 million cubic yards of debris exist. And that is like nothing that most of even them have ever seen before. As of today, 1.1 million cubic yards have been removed, and that is approximately 24.5% of all the estimated debris. For this amount of devastation, it is moving along, having nearly a quarter of it removed. But remember that nearly 40% of all of the debris is in Mayfield alone. So it's going to take longer for Mayfield to look less and less like a massive tornado have gone through it, and understand that that is where it is going to take us the longest to ultimately remove and rebuild. But we are committed to every single day of what will likely be the next 2 years to get that job done. It's also the only place that's going to require demolition on a significant scale. So again, we are dug in and committed. When we look at different totals and what's removed, I think we have just a few examples for you today. For instance, Caldwell County estimates 275,000 cubic yards of debris, 136,164 removed. Christian County, about 30,000 estimated cubic yards, about 12,058 removed. Fulton County, it's about half, but look at Graves, 2 million cubic yards of debris. That's going to take significant time. And remember, some of these places that have been hit, when it is just residential, it may be a more simple ability to pick up debris and ultimately haul it out. There are large buildings, large government buildings, banks, churches, etc., within Mayfield that are going to take significant work to get down or to remove the debris that can be removed if part of the building can be salvaged. That is going to take more time. Hart County, moving along. Hickman County, about halfway done. Hopkins County, this is the third most debris, even though it was hit in the second deadliest way, 222,261 cubic yards out of the full 700,000. Marshall, thank God there weren't more people lost in Marshall County because a huge amount of devastation and debris. And then you can see ultimately the totals, 1,146,605 total cubic yards thus far removed of the estimated 4.673 million total. Next, the Team Western Kentucky Fund. We announced last week that through the Team Western Kentucky Tornado Relief Fund, the state is going to be adding 20% on top of what FEMA awards in individual assistance for uninsured homeowners and uninsured renters that were severely impacted by the storms. This means that at least $1.4 million is going to be paid out from the fund. It's going to be going out to more than 1,400 Kentuckians who are registered, who have qualified, and who have already been issued FEMA payments. There will be others that FEMA will issue payments to, and that will trigger payments from us. Checks will be going out within the next 2 weeks. We have now gotten the information and the agreements in place for the data sharing. Those families will be reached out to directly. They'll need to sign a statement saying these funds are not for identical purposes for what FEMA is reimbursing them for. Once we get that signature, we can cut the check. It's that easy. There's no separate application process, and it ensures that everyone we're sending a check to has been harmed. They've already gone through a full vetting process and been approved. So we know that there should be no fraud, and also no additional work on families that have been through so much. The number of Kentuckians who are eligible who will receive the extra 20% include at least 475 uninsured homeowners and 987 uninsured renters. Again, more are likely to be qualified soon. In addition, we've now provided payment for every single family that lost a loved one for funeral expenses, all 77 Kentucky families. We expect in the next couple weeks that we're going to be able to announce that the 20% additional payment will be extended to insured homeowners and insured renters as well. We think that we're going to have more than enough in that fund. We're just trying to take the steps at the appropriate time to ensure that those that need the help the most receive it. It's important to note that this fund is for the medium and the long term, when so many others are set up for the immediate aftermath of the event. It's also important to know that it doesn't take the place of other programs that provide day-to-day needs. Those are our sheltering programs, where we're already providing people a place to stay at no charge. It is not a substitute for food assistance programs, where we have disaster food assistance or the normal food assistance programs. It's not a substitute for the additional healthcare options that we have for people right now. And it is not a substitute for either traditional or disaster unemployment, which can give people regular help that they may need right now. All of those resources are on the governor's page, as well as links on the FEMA page. Let's make sure we get you to the appropriate program. Kentucky State Parks are providing housing and food services for 352 displaced Kentuckians and 58 first responders, down a bit since the days directly after the tornadoes. We're continuing to work with the Red Cross and FEMA to ensure each of the individuals are receiving the proper assistance. Part of that is a case management program where the Red Cross is verifying that those that are at the parks or in motels are in fact displaced, and they even go out and look at the addresses they are given. Now, during the course of this, we will find at least some people staying in those facilities are not fully displaced or can now return to their households. There will be a point where we have to make that happen. Again, these are programs that require us to verify and take action if people ultimately don't qualify. We've also had some instances in our state parks that have led to a loss of volunteers due to actions of some guests who are temporarily staying at the parks. And we've had to do a couple things like implement a curfew to ensure everyone's safety. But as a result, we're in current need of additional volunteers, and we're asking anyone wishing to volunteer at one of our state parks to contact Andy Kazitz at andy.kazitz, K-A-S-I-T-Z, at ky.gov. Temporary housing assistance. FEMA's approved direct temporary housing assistance in 6 Kentucky counties: Caldwell, Graves, Hopkins, Marshall, Muhlenberg, and Warren. FEMA's contacting survivors in these counties who applied for assistance and who may be eligible for this housing. We've also been working directly as the state with data from Graves and Hopkins County officials, with the American Red Cross, and with our FEMA partners to assess the sheltering needs of our displaced families and to speed the program up. We are especially focusing on families with children in the various school districts that have been impacted to get them as close to their district as possible. So today, I'm pleased to report that the Commonwealth Sheltering Program has finalized the purchase of 200 new travel trailers for those impacted families. That is an interim step where we'll have people in there for 6 months or so, where we can get them closer to their homes, within their school systems, back in their communities, to help rebuild their lives, knowing how long it is going to take to ultimately get everything rebuilt, from houses to rental units. This is a necessary step. We are choosing the travel trailers because the alternative, which we would call a trailer or a mobile home, oftentimes you cannot get removed. after the disaster. They end up abandoned, and they are a challenge. These travel trailers are not only nice and provide more space for families, but they have a resale market value, and we will be able to clear them out once people can return to their home. We are working on the placement of these. I will say that I'm not satisfied with the progress, but by the end of this week, we will have the first 10 travel trailers in Mayfield and the first 10 in the Dawson Springs area. That'll mean we'll have 20 hooked up, ready for families. And it is not only my hope, it's been in my instructions that we're going to have some families in them by the end of this week and continuing to speed this process. This is the period of time where maybe some of the initial shock wears off. You've been in a hotel for almost a month or a room at the state lodge. We all start itching, wanting to have more space and be back to normal. Sadly, when a tornado has completely wiped out your town, it's going to take a lot longer to get to a normal. But this is an interim step that we think will provide, again, more space and more comfort to our families. It's a process that Louisiana and some others have been some of the first to innovate on, but we're having to build a lot of this from the ground up with FEMA's assistance as we go. The funding for these trailers and wraparound services for children was recently passed by the General Assembly. I thank them for that. It's a bill I signed into law just over a week ago. I want every family touched by these storms to know that we are with them, and we're going to continue to provide updates. Remember, it is a long process. We're going to be there every single step of the way, but a lot of debris to remove, a lot of rebuilding to do, but we're going to get there. We just got to persist. We got to be patient, which is really hard when your life's been turned upside down and in the midst of a pandemic. But again, we'll get there. One piece of good news, and then I'll turn it over to Dr. Stack. Appalachian communities can now apply for grants to help them achieve economic and community development goals. The Kentucky Division of Abandoned Mine Lands is accepting applications in anticipation of receiving 2022 AML grants. The deadline to submit one is April 1st, 2022. The grants are creating hundreds of jobs and helping to build a strong economic future in eastern Kentucky counties. Previous successful grant applications include industrial development, workforce training, infrastructure, tourism, agriculture, and community wellness projects. Since the program's inception, 63 projects in 23 counties in Kentucky have received collectively $138 million in funding. Once projects are completed, that will have created more than 2,800 new jobs in the region. Now, just this past November, U.S. Representative Hal Rogers and I announced $9.18 million in AML grants for economic development in 10 eastern Kentucky counties. Just to give you a few examples, Cold Storage LLC was awarded $2.5 million for construction of an agriculture cold storage facility in Martin County, in which an underused spec building will be converted into a refrigerated commercial facility. That's going to help one of the large agri-tech projects in the state, growing apples on abandoned coal mines. ARC, Appalachian Regional Healthcare, was awarded $750,000 to equip the Highlands ARH Medical Center in Prestonsburg with a diagnostic CT scanner and mammogram equipment. And Hazard Community and Technical College awarded $280,000 for equipment purchases to expand its successful lineman training program. Have a friend whose son just went through that program, already has a job. To learn more, visit the Kentucky Division of Abandoned Mine Lands website. We are committed to building a better Kentucky. Now, we just got to get through the challenge of the present, this pandemic. I will turn it over to Dr. Stack, who I guess I would say is in the regular studio for that update.
Kentucky. So I get to go over the entire COVID update. If you want to put up the slide deck, Scotty, we'll get started with that. So on Saturday, we had 13,797 new cases, 29 deaths, and a positivity rate of 32.65%. Of those deaths, 4 of them were under the age of 60. 1 was 20 years old. On Sunday, we had 11,648 new cases, 25 new deaths, a positivity rate of 33.1%. And of those 25 deaths, 7 were under the age of 60. We had a 42-year-old, 56, 56, 50, 51, 52, 55. And today, on Monday, we've announced 3,912 new cases with 22 new deaths. And the current positivity rate for today is 33.06%. And out of those 22 deaths, 7 of them were under the age of 60. And we had 5 more who were 60 or 61 years old. So that's 12 individuals out of 22 who were 61 or under. I make that point because 94 to 95% of all of the COVID deaths in Kentucky since July 1st are in unvaccinated persons. And this is obviously a tragedy for these families, and my condolences go out to the families. Unfortunately, these sufferings usually don't need to occur. Vaccination almost entirely eliminates this risk. So I do hope more folks will continue to get vaccinated and protect themselves from that horrible outcome. I'm going to use the purple stair stepper graph here and show we announced for last week now 83,159 new cases last week. It's a new record. These are records we'd be grateful not to set week after week and day after day now. I'm going to draw your attention. Last Friday we had, and I know the governor shared this in one of his updates, 16,131 new cases on Friday the 21st. 16,000 cases, if you look here, that's where the plateau was right before we started the steep climb. So look how much lower that is. It's almost like standing on top of a skyscraper and looking down how much lower 16,000 cases in a week is, and we announced it in one day last Friday. So this really is a unique part of the journey here with COVID-19. Now, mercifully, the disease is not quite hitting people quite as hard, and it's not filling the hospitals proportionally to the same extent, but I'm going to talk about that in just a minute. Next slide, please. The positivity rate, of course, is a reflection of testing adequacy. It shows, are we testing enough to find all the disease that's out there? The answer is very clearly no. No one is able to keep up with the Omicron variant. It has outstripped testing capacity everywhere that it has struck. So we are up to now 33.06% today. Yesterday was 33.1%. I want to put that in context, though. We know there's a lot more home-based testing, at-home testing, that's not reported to us. So hopefully people are making good use of that and acting on those results to keep themselves and others safe by isolating at home if they test positive. Additionally, though, there are still a lot of tests reported through the regular medical infrastructure and the various testing companies directly to the Department for Public Health or the local health departments. Over a 5-week period from early December until last week, we went from 101,000 or so lab results reported to the state all the way up to 203,000 tests. So we doubled in 5 weeks the number of tests being reported to public health in Kentucky, which is an incredible response from the testing infrastructure. It's just that the testing can't keep up with how rapidly Omicron spreads. Next slide, please. We'll talk about the hospitals real quick here. The story is mixed. On the big level, it's not good. So you can see that on the right-hand side of this graph is the current level of hospitalization. So for today, it's 2,326 people in the hospital. There was a little peak leading into the weekend of 2,366, and that is just barely beneath the all-time high that was set in Delta. So on the good side, proportionately, fewer people with Omicron are going into the hospital. And that's probably because the disease is both more mild and also because there are people who are vaccinated now, a lot more vaccinated since the Delta surge. And then the prior infections probably have some protective value as well. And the combination of this has helped. But still, that means we've got over 2,300 people in the hospital filling up a huge part of our hospital capacity, specifically with COVID patients. And the issue about are they there for COVID or because of COVID? Most of them are there for COVID. It's a relatively smaller proportion. I don't have a number or specific figure to give you, but most of them are there because of COVID, not because they incidentally have COVID, although there is some of that too. Next slide, please. So here's the better news, if there is some better news, is that fewer people go into the intensive care unit relative to the Delta variant and prior variants. And so even though we're almost near our all-time high peak in total hospitalizations, they're probably in regular medical and surgical beds and not in intensive care units. And so we are not anywhere near our peak for ICU utilization that we reached last fall. Next slide, Scotty. And then on this slide, you see the ventilator use. And this virus in some ways almost behaves like a different virus. It does not appear to hit the lungs nearly as hard for most people as the prior versions did. And so we don't appear to have any danger of running out of ventilators. The problem, though, is, and if we could do the next slide, please, we're running out of healthcare workers. And so there's a lot of beds in hospitals, and there's a lot of ventilators and a lot of other equipment, but not a lot of people to operate all this stuff. And as a more than 20-year practicing emergency physician, let me just assure you, you need the people. The machines don't do any good without the people. And so these are two news articles. I was looking at the Wall Street Journal yesterday, and the one on the left is from a hospital in Houston, Texas, and they were talking about how the number of COVID people is overwhelming the hospitals and pushing out patients with other non-COVID needs. So people who have other medical and surgical needs don't have beds to go into at the hospital because the COVID patients have occupied them. And overwhelmingly, it's unvaccinated individuals who are filling the hospitals with COVID illness severe enough to require hospitalization. And these healthcare workers, in addition to having a lot fewer of them available because a number of people have left their professions due to the strain and the distress and the short staffing that they face on a regular basis, they're also traumatized in a different way because they are seeing death at a frequency and a regularity which is really unprecedented in any of our modern living histories. You'd have to go to a battlefield circumstance to get something comparable to the rate of death that they face on a regular basis in the hospital. And that takes a toll. It's a PTSD of a different sort. And so it's really, really hard on these healthcare workers and a real concern for ultimately the sustainability of the healthcare system. So there are ways you can help with this, though. And I've said these things before. First, do not go to an ER. Please don't go to an ER for a COVID test. That's not an appropriate use in the emergency department. And it just overwhelms already overwhelmed healthcare systems and emergency departments. If you have mild to moderate illness, stay home until you feel better. And when you feel better, you can go about your business. If you think you're sick enough to need medical advice, call your doctor. And if you think you have an emergency, by all means, then go to an emergency department and they'll do the best they can to take care of you. Before I talk about the future outlook, I'm going to give just a little verbal comment here. There's other places that COVID has impact, obviously. So the other article here on the right-hand side talks about how other businesses have been impacted. I would have to believe anyone who hears me either live now or on a recording after this, you've all been impacted by this. You've all gone to stores and seen empty shelves. You've all gone to a restaurant and you've had to wait longer than usual or found that their hours are curtailed. You've tried to go to some kind of pharmacy or some other place of business, or you've experienced difficulties because for your school where your child goes, there's not been enough bus drivers or cafeteria workers or teachers. This has been a problem. It's hit a lot of places. The one thing I would observe here is this is entirely the virus and businesses and schools and others acting in response to it. Thankfully, Omicron is not as deadly as the earlier versions, but this is the kind of worrisome situation we were concerned about a year and a half or more ago earlier in the pandemic, was if we didn't have treatments, we didn't have vaccines, and disease spread this widely, it would not only shut businesses, but we would have had much larger death tolls. So for right now, please, you too can have an impact here. Wear a mask whenever you're out in public in indoor spaces. Please get vaccinated, and if you're eligible, get boosted. If you're sick, please stay home. Don't go to school or work. And cover your cough and use good hand hygiene as well, please. The other thing I'm going to mention, I don't have a slide for this, is the current status of the Kentucky Department of Corrections and the state prisons. So there are currently, at least the data that I've been given for today, 193 of the staff members who have COVID-19 actively and 872 inmates who have COVID-19. Now, the good news is that because of vaccinations, the vaccination rate is incredibly high in the inmate population. It's about 85%. There are very few to no hospital runs for these inmates. So the inmates, thank you very much for stepping up and protecting yourselves and those in your congregate setting. The guards, though, are much less vaccinated, and I think that's taking a differential toll on the workforce in the prisons. So we need to continue to work to get those vaccine rates up. If we could do the next slide, please, Scotty. This is where I would have typically started for this week. I've shown a slide like this 3 weeks in a row now. This is from 91-divoc.com. And this shows today, I left Kentucky off here intentionally to make it easier and less cluttered. We have Rhode Island, New York, and the United Kingdom. Rhode Island is green. It's the tallest spike. New York is orange, and the United Kingdom is blue. And the reason I showed this, you'll notice pretty obviously, all of these have this steep jackknife type pattern. It goes up real fast and it comes down real fast. And they've been coming down. Once they start the descent, they keep on going down. It's not like they plateaued yet. All of these other places look to be about 3 weeks or so from the start of their surge to the time they reach the peak. And if that's the case, then hopefully this week will be our peak. Now, our vaccination rates are lower in Kentucky than in all 3 of these other places, Rhode Island, New York, and the United Kingdom. So we could have a wider spike here than these other places. But even so, that should mean over the next week, 2 weeks, hopefully at the longest, we should start seeing the backside of this escalation. So if that's the case, that's really good news. Now, we won't know that we're in the decline until we're far enough into it to have clearly shown that the trajectory has changed and we're going downwards on a steady basis. Even on the backside, remember, it's been painful for hospitals on the rise over 3+ weeks. It's going to be still difficult on the decline, which means there's still another month or more of difficulty for the hospitals as they try to keep up. So please follow those things I've asked you to consider to keep people out of the hospital and safe. If you do the next slide, please. I'll just do this very briefly. We intentionally picked some of these dates for a reason. March 1st is when the data on this slide starts. This is to show if you did the recommendations we've given you, if you got vaccinated when you were able to and you kept yourself up to date, what would your protection have been with the vaccines? And this shows that the protection against just getting infected went down a little bit to under 80% for new cases. And we knew that was happening probably because of some waning immunity, and that's why the boosters are now recommended, and also because Omicron spread so much more. But the protection against hospitalizations and severe illness remains very good. And so if you are vaccinated, you are very much in a better position than if you are unvaccinated. Next slide, please. Now on this one, this breaks it down month to month so that you can see our journey over time as we have different variants and different situations. And this just shows how well does vaccination protect you against getting infected. For most of this journey, it's been 3 to 4 times better off if you were vaccinated than if you were unvaccinated, meaning there's a 3 to 4 times higher risk of getting infected if you're unvaccinated. It's fallen a little bit. Now it's down to 2.4 as a protective benefit, but that's still pretty good if you think about it, to have 1 infected person for every 2.5 uninfected people. If you were, probably said that wrong, if you to have 2.5 people, 2.5 times risk reduction, let's just say it that way so I get it more accurate. So please continue to get vaccinated. Next slide, Scotty. I'm not going to go row by row on this particular one. This is the whole image on one fell swoop. Some good news, the total number of Kentuckians vaccinated, the total percent is up by 1% to 64% at the top. The total for people 5 and older is 68%, and the total for 18 years and older is 75%. So that's pretty good, but we've still got a ways to go, and we know it's very unevenly distributed. 75 and up are the rock stars, as the governor, as are the 65 to 74-year-olds. We have 92% in the oldest category and 96% for people 65 and older. And then it goes down from there. I'll note that for the 18 to 24-year-olds, they've increased by 1% since the last time we showed this, so that's at 55%. And for 5 to 11-year-olds, the percent that have had at least 1 dose is now 20%, which is up by 1%. Just to put this in context, we've vaccinated a total of 2,842,876 Kentuckians, and we've administered, probably as I'm talking here today, 8 million doses of vaccine in about 13 months. It's a staggering accomplishment when you put it in perspective. I'll also observe we have, as I mentioned, a wide disparity between different counties. We have some counties like Fayette with 76% with at least one dose. Woodford was 75%. And then we go all the way down to the other end of the spectrum, and I won't mention the other counties' names, where they're down to 33 to 39%. All that's on the KY COVID website on the vaccine dashboard. Next slide, please. I have two more here on the slides, and then we'll wrap it up. So this is just a different way to look at the vaccine data, and I want to give a little bit of good news and a little bit of more work for us to do. So this is the percent of people who are fully vaccinated, I mean they got 2 doses of an mRNA vaccine or 1 dose of J&J, who then got boosted. Okay, so all the booster eligible people who got boosted, Kentucky, 64% of all the booster eligible people have gotten boosted, which is wonderful for that high of percentage. And in fact, it outperforms Region 4, which are the southern states we're part of, and also the national average. And we still outperform both the nation and the region on an average basis when you look at the people 18 and older. Next slide. Here, and I put the faint green there to try to show where the biggest numbers are. Here we have more work to do for children and adolescents. The good news is for 5 to 11-year-olds, the percent that have at least 1 dose is 20%, and I already shared that. But the percent that are fully vaccinated was only about 13.3% as of last week. Now, these vaccines were only approved for children a few months ago. A lot of work has been underway. We want to make sure people are comfortable, have access to this at their pediatricians and in healthcare providers where you're comfortable. So please, I would urge you, if you're a parent who has not yet had your sons and daughters vaccinated, please talk to your pediatrician, your primary care provider. Ask them about the vaccines. The American Academy of Pediatrics, numerous other medical associations, and other public health bodies have all recommended vaccination. It's the safest way to keep kids healthy and well and in school, and also to help protect their families at home who may be more vulnerable. Also, it does help. They've proven now that it does help reduce the risk for that multi-system inflammatory disease that sometimes strikes children a couple months after the initial disease and sometimes ends them up in the intensive care unit. It's uncommon, but you don't want to have that happen to any child. And if the vaccines prevent it, it's well worth getting the vaccine. So please talk with your personal physicians about that. I have just a couple more points. You can take that slide down, Scotty. I think that's the last one. Yep. So there are 2 oral antiviral pills. One is the Merck pill, molnupiravir. We've shared concerns, both the governor and I, that for most people it may not be a good option. There are some folks for whom it probably is a very good option, though, because it's better than the alternative. If you are 50 or older and you are unvaccinated and you get COVID, you should talk to your doctor probably and ask if molnupiravir is a good choice for you. It has about a 30% reduction, we think, in reducing your risk of going in the hospital or getting or dying from the disease. Walgreens is the only pharmacy that currently has it. There are currently, I think it's 52 sites that have the molnupiravir, and they're all on the website at kycovid19.ky.gov. And by the end of this week, it's going to extend to 138 to 140 Walgreens stores. So I would encourage you, if you are unvaccinated and 50 or older, if you test positive for COVID or you develop symptoms, you have to start the medicine within 5 days of your symptoms beginning or your positive test if you have no symptoms. Please talk to your doctor, talk to your primary care provider. You have to have a prescription from a physician, physician assistant, or nurse practitioner. If you get those things, then you can go to a Walgreens and hopefully they'll have this. They'll probably, if they find the demand is increasing, order more to those stores and be able to have an adequate supply. And the final thing, Evusheld, that's a long-acting pre-exposure monoclonal antibody. On our website, on the monoclonal page, we have a list of the sites that have Evusheld with the little red Evusheld next to their name. We're going to expand that and hopefully get it to most, if not all, of the state-based monoclonal sites on the website. If you have moderate or severe immunocompromising conditions, so think about organ transplants, leukemia, lymphoma, you have other cancers on chemotherapy, you have rheumatoid arthritis or other autoimmune diseases, and you're on high potency biologic agents, all of those things could potentially make you eligible after you've been vaccinated to go and get this in addition, because your immune system may not mount an adequate response to the vaccine. So I'd encourage you to please talk with your physician if it's a good option for you. We're going to try to get it in the next week or so to all the antibody sites around the state so you have access to it. Thank you very much, folks. I know this has been a very, very long journey. We're not finished yet, unfortunately, but pandemics do end, and we've got to keep up our hope, because I really do think, notwithstanding the difficulties we face now, with the exception of the hospitals and the nursing homes, which do have kind of a long road ahead to try to recover and rebuild after this mess, for the rest of society, I really do think 2022 is going to look a lot better. And I think we're going to get to graduations in the summertime, and it's going to be a lot better. And we're going to be back to a lot of our activities in much the way we used to enjoy them. And hopefully we'll learn to make use of masks and getting vaccinated on a regular basis when they're necessary and appropriate to try to further reduce our risk. So I think we're going to do questions now, and the governor's going to do this remote from the mansion. I may have to, I think, repeat your questions if he can't hear it. We'll have to see how that works. So,
Sure.
So why don't we start
Steve,
within the room? Yes, sir.
Yeah, thanks for the update. And I think in the room, we've got at least 3 journalists, including Karen Czar. So why doesn't she kick us off?
Governor, can you hear me?
I can hear you.
Okay, great. I have 2. The first is, do you anticipate we will have to send in more National Guard to help with the hospitals? And then the second is, first of all, best wishes that will remain asymptomatic. But as a parent who is now going through this, to parents who are still going to go through this, what is your message to them?
Well, we don't necessarily anticipate adding more National Guards to hospitals, though we may move them between hospitals. Our hospitals right now are anticipating what we are, that this may be the highest week, followed by a decline, or at most, we're hopefully looking at 2 weeks. So everybody is hunkered down, pushing through. Yes, there are real concerns about staffing, but there does appear to be some light at the end of the tunnel because of Rhode Island, New York's experience that we are seeing. And the challenge is that Omicron is hitting everybody. And so even those that we would try to send in as additional help, are facing that challenge out there. As a parent, I never wanted either of my kids to get COVID, but I got them vaccinated to ensure that they were protected if they did. My son is fully vaccinated. He is boosted. We ran out right after the CDC provided that guidance, and he's shooting basketball right now like nothing ever happened. That's the exact reason that we wanted to get him vaccinated. And now we want to do the responsible thing, but he does too, in that he doesn't want to get any of his friends, vaccinated or unvaccinated, infected. And so following the guidelines to ensure that that doesn't happen. It's a little scary when one of your kids tests positive, but I have been watching this for 2 years, living in it in real time, and know, especially with younger adults, but for that matter, my age and all the way down, if you're vaccinated and boosted, Omicron isn't going to make you very sick at all. Chad Hedrick.
Governor, Will's diagnosis comes as several school districts across the state are having to switch to NTI learning because of students and staff testing positive. Just kind of walk us through your thoughts of seeing this surge. And Dr. Sack, you also want to weigh in. Just we're seeing more and more of these cases in schools and having to use these NTI days.
Will's school requires universal masking. In school, it has prevented significant outbreaks. They have not gone to a single day of NTI. There's everything that occurs outside of school, though, too, which can be a real challenge. Again, I think Omicron is so contagious that even your best efforts don't fully prevent it, though they can certainly lessen it. And I think what we are seeing is that this period that we're in, this height, hopefully the most contagious this virus will ever be, is having a short-term impact. But again, we hope to be turning the corner. Schools that have to go to NTI, but then come back with universal masking, we believe will be able to stay in. and not be out on NTI. Again, there are some, I'm sure, that are going to take a false security from when we start to drop. But remember, the first week that we start to drop is still going to be at a level that is 10, 15, 20 times more contagious than other times during the pandemic. So we're going to have to be patient for several weeks, perhaps even 3 or 4 as we come down from the height of it, to continue universal masking if we want our kids to be in school every single day. Steve, you have anything to add to that one?
Just that we're supporting the K through 12 schools with a lot of testing. So 1,395 schools across 105 counties are enrolled in our K-12 testing program. We provided over 660,000 tests since the beginning of the school year to teachers, staff, students, and household members of the students. And that program is working very, very well. And if you wear masks, if you require masks in the building and make use of that resource, I think I agree with the governor entirely. You can safely stay in school, and your likelihood of having to shut down is tremendously reduced.
All right, Mike Valenti.
Thank you, Governor. I'm glad to hear Will is doing okay, and I wish him and your whole family the best. You may remember a few weeks ago, I asked you about some of the confusion surrounding the revised CDC guidelines shortening the period of isolation to 5 days. And you had talked about it. If this was your family, you would want to wait the 10 days. Now that this is hit close to home, as parents, are you and the First Lady leaning towards having Will isolate for 10 days, or if he's asymptomatic for 5 days, to go back to school?
We're going to follow the current CDC guidelines, except that we are going to test, right? We'll be testing him at 5 days, just like I'm testing myself every single day to ensure that I'm negative before going about my day. We just want to make sure that we're protecting everybody around us. We want Will to get back to school as soon as possible. His case is really mild, so we don't anticipate any challenges with getting him back, but he's going to want to be negative, just like we're going to want him to be negative before he returns. April Rickard for WFPL.
Hi, Governor. Thank you. What percentage of hospitals are seeing critical staffing shortages, and how many are operating under the CDC guidelines for staff returning sooner if they've had COVID? I think last week you said there were 3. I just wondered if there was a change. And second, are you seeing any drop in Omicron in areas that test wastewater for it? Thank you.
So the hospitals, it's about 33, 34 that are reporting critical shortages. But to be fair, they are all experiencing major staffing challenges. But they also know what we're facing. They know the general timeline of it. And I think everyone is just hunkered down to push through it. Every healthcare professional wishes more people would get vaccinated and boosted and take extra steps to prevent the spread. But now that we are at or near the peak, they know that a whole lot of the hospitalization that we're going to be seeing is baked in, and we've got to push through it. Steve, any addition?
Well, just that the question about, we mentioned 3 facilities that told us that they'd invoked the crisis staffing model for the CDC. We know that there's a lot more who have done that and taken steps. There's not a requirement that they inform us. We believe they're acting in good faith and they're complying, and we're in regular communication with lots of hospitals. So it's undoubtedly much larger than just 3 facilities who are having to take those steps. And we'll never know the exact number. It's more important just making sure that patients are getting care that they need, and that the hospitals are taking all the steps they can to provide it as safely for the patients and their staff as possible. And I have great confidence in the Kentucky hospitals that they're doing that. Governor?
Debbie Yetter from the Courier-Journal.
Hi, Dr. Steck mentioned that the level is actually of infection is probably much higher in Kentucky because of all the at-home tests. Are there any sort of rule of thumb estimates on how much higher it is, or can you speculate on what you think it might be?
So Dr. Stack and I were talking about this the other day, and there's not a direct scientific way to estimate it. The best way that we think you could do it if you could get the numbers are we have such a large sampling to get the positivity rate with so many people getting tested, even just through PCR, that we would expect the at-home testing rate to be at or around the same positivity rate. So the number that we don't have that we think we could use to try to get close to it is the number of at-home tests that have been sold in Kentucky. The challenge there, though, would be that just in our case, I took a rapid at-home test. It was negative. I got a PCR as well. So it would be hard to know how many individuals go through both of those. We do know a number of folks that get the at-home test positive, then get the PCR for accuracy. Steve, is that about right in what we were thinking the other day?
Yeah, everything. The one thing I'd clarify, just because there are people out there who really track how we do the methodology. If you get more than one test on the same day, and those are done at a professional site that reports to us, we only report one test per unique person per day. So you don't get multiple tests. If you're positive, the positive overrules the negative, because then you're positive. So I feel really good that with over 200,000 test results for a given week recently, that the 30% is very accurate. And I agree with the methodology, but you'd have to call Walgreens, CVS, Kroger, Walmart, Amazon, and everyone else who ships tests, because now we do so much through e-commerce. It's just a really difficult figure in a smaller population to get at.
Tom Latek. Tom Latek.
Hey, Governor.
Even
Yes, sir. Thank you very
even
much.
from the governor's
What?
mansion, I have to take a question from Tom Latek.
Oh, come on, man. First of all, let me pass along my best wishes for Will, because baseball season's not that far off, so he's going to have to get back in shape and do that again. Now, here's my question. I did order. In fact, I was able to do it the day before it really opened up, the free home tests from the federal government, but you only get 4. And I was wondering, is the state looking at doing a similar service for Kentuckians?
Well, the challenge right now is the limited number of at-home tests. And I say limited. There are millions of them, but the demand is just enormous at the moment. And overall, I think that's a good thing. People want to be safe. We could not order large numbers of them right now if we wanted to, because of the amount that the federal government has bought and are supplying. We got to wait for 2 things to be able to at least have that possibility. One is for the federal program to run a little bit. The second is for manufacturing to further pick up for these at-home rapid tests, which it's going to. If this thing doesn't on its own move more endemic, I do believe we have a future where we can do a whole lot of things through having as many rapid take-home tests as you would want, whether you're having people over to be able to do it really quickly, whether it's everybody coming to an event or a party. So right now, we are not planning a program on top of the federal government because the supply is not there. As we move forward, we're looking at all options, but we also want people to be able to secure these at normal places they would visit, kind of the same way that we need vaccines to be at those places, because some won't do what you did and order ahead, but then they'll really need one quickly at a certain moment. So our hope is that the commercial market will also fill this void, and I do think it will. It's just no one could have seen the demand for testing spiking as dramatically, as quickly as it did, because we hadn't seen anything like Omicron in terms of its aggressiveness and spread to date. We thought Delta was one of the most aggressively spreading viruses that we'd ever seen. This is probably the most, or number 2 next to measles. All right, Melissa Patrick, Kentucky Health News.
Hi, Governor. I have two questions if I can, but the first is the Lexington Hospital doctors today. One of their key messages was to upgrade your mask to a KN95 or an N95, and suggested that even children heading to school need to be upgrading their mask. Have y'all had any discussion about providing money to schools to help children upgrade their masks to these KN95s?
Well, right now for school assistance, we're certainly providing tens, if not close to, I think, $100 million of testing assistance. We have the Covering for Kids program, which provides surgical or close to surgical level masks. And we're always looking for that next way that we can help school systems. Now, as you know, we got some school systems that don't require a mask at all, much less a KN95. So, Steve, you want to add?
As to where the best quality mask you can get that's well fitting as reliably as you possibly can. So do the best you can with the best you have. The governor's already outlined the many programs that we're doing. The federal government is going to ship out a lot of KN95s and make them available apparently through pharmacies. And then they've also offered to send to the states an amount, and we should hopefully get over 500,000, and we'll try to figure out the best places to deploy those. But I agree with the governor. The first step is to require masks of any sort in the school setting. The next step then is to upgrade your mask. So we'd be really, I think, grateful if we just got every student wearing masks to keep them in school safely. Governor.
Great. I want to thank everybody for joining us today. Thanks for holding it down in room 110, Steve. Virginia, thanks for helping us from multiple locations. It's actually, I can see you on this one when I normally cannot. Everybody, make sure you stay safe. We hope that we are cresting, that we are near the peak of what we'll see. Remember, even if that's the case, it's going to take us at least a couple weeks, if not 3, to get to a much safer place. But we ought to be able to see light at the end of this tunnel, at least, and push on through it. Thanks for all the well wishes for my family. We are just fine. We will be just fine. We got vaccinated and boosted so that we would be sure that we were just fine. And I hope every other family will make that same decision. Thank y'all.